Hi, I'm Kelly Munoz. This is my audience for today. How many of you heard about the Plan B or the morning after pill? Well, it's a high-dose birth control used by people to avoid pregnancy if used within 72 hours of having unprotected sex. Previously, this pill was available to those only 17 years and older without a prescription. Recently, it came available over the counter for 15 years and older without a prescription with proof of identification. Today, I'm going to tell you many different reasons why Plan B should not be available over the counter. I have researched both sides of the argument and found more reasons as to why the Plan B should not be available over the counter. First, I will tell you some risk factors with taking Plan B. Second, I will tell you why people should receive some kind of counseling. Lastly, I will explain some more reasons why you should see a physician to get a prescription. Though most of the side effects from Plan B can be minimal, there are some major concerns that can still exist. These side effects can include nausea, vomiting, dizziness, breast tenderness, bleeding between periods, heavier periods, lower abdominal pain, and diarrhea. A lot of these side effects can mimic pregnancy or ectopic pregnancies, which would need to see a physician. The Plan B website advises that if any of these symptoms continue for more than a few days, you should contact a physician. One major concern can exist when taking Plan B with certain medications that control histories of asthma, blood clots, diabetes, or seizures. Hippocrates is a fully accredited software that is used by many healthcare professionals. It can be used to check contraindications of medications. According to this software, there are 29 medications that can lower the effectiveness of Plan B. WebMD states that there are 21 medications that could have serious interactions and 10 medications that could have moderate interactions if taken with the Plan B. If a patient were to have an allergic reaction to the Plan B, it would be advised to follow up with a physician to avoid any serious side effects such as anaphylactic shock or respiratory distress. Next, I'm going to tell you some statistics that will back up why you should see a physician to get a prescription. According to the Center Disease Control, in their article, Preventing Teen Births, nearly half of the women in all age groups reported using the emergency contraceptive Plan B. Of these women, the ones with less education used the Plan B after having unprotected sex, whereas more educated women used the Plan B due to contraceptive failure. According to the same article, nearly 1 in 5 births to teenage mothers from age 15 to 19 were repeat births. In the article, it states that healthcare providers and communities should help sexually active teenagers gain information about birth control, counsel them as how they can avoid additional pregnancies, and help connect them with support services that could also be helpful. Now that Plan B is available over the counter to anyone 15 years and older, how are they supposed to be counseled or given information if they never have a chance to talk with a healthcare provider? According to Marcia Clement, in her article Birth Control Debate, it stated that about 3/4 of the women ages 18 to 44 polled stated that they heard of the emergency contraceptive, but almost half confused it with the abortion pill. I am 34 years old and was also unclear about the difference between Plan B and the abortion pill. If adults confuse this, how are we supposed to expect a 15-year-old to grasp the same concept without proper education? The first thing I would like to talk about is unprotected sex. One major concern with unprotected sex, aside from pregnancy, is sexually transmitted diseases, or STDs. According to the Center of Disease Control, in their article, Rates of Reportable STDs among young people ages 15 to 24 years of age, Texas, 2011, there were approximately 88,000 cases of chlamydia, 20,000 cases of gonorrhea, and 450 cases of syphilis alone just in Texas. In 2013, the CDC reported 20 million new cases of STDs each year. The cost to treat the STDs in 1 year is approximately $16 billion. Half of all new sexually transmitted diseases were among the youth. Working in urgent care for the last 8.5 years, I have seen a significant increase in the number of patients that we treat for STDs of all ages. Another important reason to see a physician would be for annual checkups. It is recommended that sexually active females have annual well-woman exams. During these exams, pap smears are done, cervical cancer screenings are done, HPV checks, and breast exams are conducted. It's proven the best way to prevent pregnancy is to be on a consistent form of birth control. The last reason why healthcare professionals should be involved in assuring Plan B users are receiving proper counseling is that anyone having unprotected sex should be counseled about risks, birth control usages, STD testings, and given resources to follow up with it if needed. First, I told you some risk factors with taking Plan B. Then I told you why you should receive some kind of counseling. Lastly, I explained some more reasons why you should see a physician to get a prescription. As you can see, there are many valid reasons that you should get a prescription for the emergency contraceptive Plan B. Some argue that having Plan B available to teenagers will eliminate teenage pregnancies significantly. I do agree that teen pregnancy is a very big problem that definitely needs to be addressed, but I do not think that this will solve it. A better long-term solution will be to talk to sexually active teenagers about having unprotected sex, getting them on a consistent form of birth control, and by having young women come in to get a prescription for the Plan B, healthcare providers can help teach them how to be more responsible with their health as they go into adulthood. Thank you. And then here's my audience.